Today I want to talk to you about orgasm, ejaculation and erections. Now I know we all think that these three things go hand in hand. However, actually they don't, which is quite surprising. I always assume that these three things happen together because we don't often think about how something works until it's not working. I spend a lot of time in consults explaining this to patients and their partners, and usually they're shocked. I even spend quite a bit of time teaching other health professionals about this. The first time I learned about these three things being independent of each other was when I was studying sexology at Curtin University in Perth, Western Australia. In one of my lectures, the lecturer showed an educational video of a young man who had a spinal injury. In the educational video, the young man with the spinal injury has his anatomy stimulated, which resulted in him having an orgasm and ejaculating, despite his anatomy remaining flaccid. It was quite surprising, and I turned to the woman next to me, a practicing gynecologist, and said, "Did you even know that was possible?" And she said, "No, I had no idea. In all the training I had done up until that point, I had never seen this before." And this lady was a medical doctor with 7 years of specialty training, and she didn't realise either. So it's not surprising that the general public doesn't know this. So let me explain to you in very layman terms how this works. What we have here is a bladder, a prostate, a pelvic bone, and then the rest of your anatomy belongs here. I'll just grab Jeffrey, which you've seen in other videos of mine. This Jeffrey, he goes on the outside of your body. As I've said many times before, Jeffrey is not a normal sized anatomy, so please do not be intimidated by him. He's just a very good teaching size and fits the purpose. So don't compare yourself to Jeffrey. When you've had your prostate, if you look at your prostate, the nerves are on the outside and they're responsible for sending a message to your brain to get nitrous oxide gas produced in the shaft of your anatomy. You then produce this gas, which causes vasodilation. It opens the cells so the blood can flow in and create an erection. That has nothing to do with your experience of orgasm or experience of ejaculation. When a man ejaculates, it's because they have an orgasm and their pelvic floor is contracting. It squeezes the prostate like a sponge, and you ejaculate prostate fluid and sperm. When someone has had surgery or radiation to their prostate, either the prostate is removed or its size is significantly reduced. Therefore, the pelvic floor doesn't have anything to squeeze, so the anatomy doesn't expel any ejaculate. If you don't have a prostate at all, you'll have a dry ejaculate, except maybe a little bit of urine, which is called climacturia. If you've had radiation or another type of prostate surgery, such as a TURP or green light laser, you'll often find that the ejaculate is greatly reduced or even absent. This may be because it goes back into your bladder, and the next time you pass urine, it may look cloudy, indicating that it's expelled that way. Neither of these situations causes any harm. The orgasm sensation you experience is not from these nerves. It comes from a completely different nerve. The sensation is generated by the pelvic floor contracting, which is why having a strong pelvic floor leads to a much stronger orgasm. The stronger your pelvic floor, the more intense your orgasm, and this applies to both men and women. It is possible to stimulate a flaccid anatomy when a man who still has a prostate, and they will still ejaculate fluid and feel orgasm. If the prostate is gone or reduced from treatment, it's possible to have an orgasm, no ejaculation, and no erection. It's also possible after nerve-sparing surgery for these nerves to remain intact, and in that case, the person may have orgasm and erection with arousal, but no ejaculation. This clearly demonstrates that these three functions just happen to occur together when everything's working normally. The purpose of an erection is to enable intercourse so fertilisation can occur. These functions are independent. I always encourage patients who are no longer able to get an erection to still try and experience orgasm, because that ability is not gone. Don't give up on that. It's important to understand that you can still experience pleasure, orgasm and sensation without having a firm anatomy. While it's ideal to regain erectile function, and we aim to help with that, there is still a lot of value in outercourse. The definition of outercourse is any kind of sexual activity, solo or with a partner, that does not involve penetration. So I hope this has helped explain the difference between orgasm, ejaculation and erectile function, and clarified that these three things can happen independently. Just because one area isn't working, it doesn't mean the others aren't. If you find you are struggling with anorgasmia, which means you are completely unable to reach orgasm, we can help. This often requires a private consultation, including an assessment of both physical and psychological factors. You can book an online consultation or a face-to-face visit with our experts via the link in the description below. Thanks for watching, and I'll see you in the next video.